Hello everybody, Dr. Mike here out of Functionised Integrative Therapeutics located right here in Colts Neck, New Jersey. So in today's episode, I'm going to talk about a very basic medication which is unfortunately being overused, or a class of medications called NSAIDs. So these are, your ibuprofen, your advil, or your Motrin. We're talking about naproxen, celebrex, Aleve, diclofenac. Some of the very common over-the-counter medications that we take for pretty much any sort of pain. So the reason we want to talk about them is that there are some issues long-term from people that take these just very regularly. There are a lot of us out there that do this. I grew up as a child, I was growing up playing sports all the time, so having occasional joint or muscle pain was very common. I had parents and grandparents talking about arthritis. I had a sibling that would always get headaches. And usually a first line of offense for most of these issues is, let's throw Advil at them, some sort of common over-the-counter medication. Again, these medications do work if the problem is inflammatory. If the cause of the pain is something other than inflammation, maybe it's vascular, maybe it is from a muscle cramp, so it's an electrolyte imbalance. Maybe, there's so many different things it could be. So if it's inflammatory, these will help. But unfortunately, we end up taking these medications for pretty much anything. I hear all the time, I've got low back pain, I've got shoulder pain. I took, Advil for it. Ask them, did it help? It's about 50% of the time they say yes, they say no. It does help me get an idea of what the issue is. When it comes down to it, the fact of the matter is we take these medications all the time, even when we know they're not necessarily making a difference on the pain at hand. And that's, kind of where the overdosing comes to be an issue. But first, before we get into exactly what some of the issues are and how it works, why do we have inflammation in the first place? If inflammation is such a big, bad guy in the health world, why do our bodies do it naturally? And that kind of leads into the self-answer as, we need inflammation. It is a very important part of our immune and healing system. It's just when it becomes too much inflammation or uncontrolled inflammation that it becomes an issue. Two simple examples to explain this is, let's say if you were stung by a bee. Whether you're allergic to bee stings or not, this sting is still leaving a little bit of a toxin in your system. The stinger still penetrated through our skin, some blood vessels, probably some muscle tissue, so there is some muscle damage done at the very least. So what this inflammation does is it brings a bunch of, we'll call it cytokines or inflammatory mediators to the scene. The reason why we want this is it comes with all the white blood cells and all of our lines of defense to help rebuild and heal. If it wasn't for the inflammatory response bringing in all these white blood cells, we wouldn't heal as quickly, let alone they help. In this bee sting example, it's going to help form around and stop the toxins from traveling by breaking it down, so that way it doesn't actually go through our system. They also, with inflammation, brings, we'll call it clotting factors, platelets and other cells that are going to stop the bleeding process very quickly, so that we won't bleed out from something such as a bee sting. Obviously, the sting example is far different from, if we broke our foot, but it's still there for the same reason. Even the fact that it causes pain is kind of an evolutionary standpoint. Because when something hurts, let's say we broke our foot and all this inflammation is pooling there, pain still stops us from using it. If we didn't feel pain from a broken foot, we would continue walking around on that broken foot. That, obviously is going to cause a lot of damage very quickly. So it is a mechanism built in to protect us. One, to both help with healing. Two, if there's a little bit of pain, it lets us know that something is wrong. Another very common example of how we use inflammation on a daily basis is for exercise, or really just using muscle in general. But let's use an example of, someone's trying to build some muscle. You're going to the gym, lift some weights, whether it's bicep curls, chest press, etc. The whole process of building muscle is that the muscle fibers actually tear and then re-heal. tear, reheal, and that cycle continues. It's not like we're just lying on extra muscle tissue. It does it through breaking down and rebuilding. So every time that you go to the gym, let's say you have a great chest day, and you're sore. The reason why you're sore is that you did on purpose tear muscle fibers so that way it could rebuild and hypertrophy. But with that tear, inflammation comes into the area. Again, this is a positive thing because we want inflammation there to help speed up the recovery process, build the extra muscle, and really just help us with the goal that we had in the first place. So let's just say that you have some pain, muscle tear, inflammatory headache, anything, and you're using NSAIDs and they work. Fantastic. You want to limit how long you use them and the dosage. I've seen time and time again, people literally are popping them like candy. A little ache, let's take some Advil. A little bit of pain, let's reach for the Aleve. And the reason why this causes a problem is that over years, it can cause some detrimental health effects. One of the most common and well-known ones is that it increases the chances of peptic ulcers. These are basically open sores that are anywhere in your GI tract, anywhere from the intestinal line to the stomach to the esophagus. It can really happen anywhere. There's a slightly different name depending on the location, but for the most part, they all act the same. The way this happens is that over time, NSAIDs actually stop your stomach from producing this mucus. And believe it or not, just like inflammation, we want mucus. What it does in the stomach is it helps protect the stomach lining because of all the hydrochloric acid, stomach acid that we have there. It's acidic, so it can cause damage to the stomach lining. That's why the mucus is there. But again, over time, not that much time, NSAIDs will decrease the thickness of that mucosal lining, and the stomach can actually start damaging the organ of the stomach itself. And when it starts wearing away on that lining, it can cause some blood vessels to open, and at that point, an ulcer can start forming. There are a few predisposing factors for ulcers, as well as pretty much any of the side effects of NSAID use. Being 65 years or older, our healing recovery in general is down. If you have a history of ulcers, you're more likely to get another one, mostly because of the open wounds are still in there. Also, if you end up taking, we'll call it blood thinners, or just using NSAIDs for long term, more than 2 weeks. People take them on a daily basis for months. These are all things that are going to increase the odds of something bad happening. So, one of the groups we see this in the most is actually athletes. Reason why is, they're constantly training their body. They are in pain all the time. Whether it's significant or minor, tends to be constant. So anything from runners who have a lot of, let's call it, shock absorption damage over time from running, miles a day, dozens of miles per week or more. Just popping NSAIDs all the time. I remember through wrestling, I actually remember very specifically one of the kids on the team back in high school. He had some sort of musculoskeletal pain, and he was holding a bottle of Advil. He was like, the best thing about this is you can take as many as you want. And I still remember staring at it, and then I ended up taking some too. I was in pain. Know a lot better now, but with athletes constantly taking them, they're doing everything to help their body. They don't necessarily realize the damage could come from it. Which leads to another major one of long-term use is kidney damage. We don't want kidney damage. We like happy, healthy organs. And anything we take in our body gets broken down by the kidneys and the liver. They're meant to do it. It is their job. But over time, constant medication of most varieties, not just NSAIDs, will start damaging the kidneys from needing to break it down. The substances that are broke down from the medicine has to go somewhere, and it usually gets absorbed into the organ, and this is where the damage is going to start to take place. The last of the major side effects I want to go over is one that just recently came out in a couple of research articles, got my attention, and was actually the muse to talk about this, and seeing a lot of friends take these constantly, is it appears that there is a strong correlation of constant NSAID use and the increased risk of a myocardial infarction, which is a heart attack or heart attack-like symptoms. Again, major problem. With all the things that we end up taking, it's good to at least be aware that this is something that's causing heart attacks because, like many of our diseases, this is one that's increasing very rapidly through our population. So what it looks like is, for those that are taking NSAIDs routinely, you're actually most likely to have some sort of heart-related issues in the first month of NSAID use. On that note, read any bottle of anti-inflammatories. None of them tell you to take it for a month. None of them. So if you're taking it for a month, you're already overdosing what they were meant to be for. The good news on this is that it's not it doesn't appear to be very cumulative like the kidney damage can be, meaning that once you slow down your NSAID use, the risk of heart attack or heart damage rapidly decreases again. Again, it's not good to yo-yo on and off about taking a bunch of these, but it's good to know doesn't appear to cause any major long-term damage on the heart for the most part. So, let's say you're taking a bunch of these anti-inflammatories and you want to stop. Other than, again, speaking to your competent medical provider first to make sure that it's safe and you can get some guidance on how to do it, there are things that you can do to try to help lower inflammation so you don't have to take these as frequently to begin with. My favorite method is eating it. Not medication, but eating natural anti-inflammatories. Turmeric is the major one that's going through with all the research appearing to be very good, especially when taken regularly. There's other ones like garlic, but turmeric is the gold standard right now. Take it with black pepper to help with the absorption. But it will help relatively quickly lower full body inflammation. So that way not only will it help take you out of pain, it will help prevent these small aches and pains to begin with. There's also some more herbal ways of doing it, like taking heavy doses of fish oils, DHA, some supplements such as BCQ, which are also very effective for short and long-term inflammatory control. And the best news with these is that they don't break down into poisons in the kidneys, so they won't cause organ damage. That's really what we're looking for, is healing ourselves without damaging ourselves further. A few other things you can do to help try to control inflammation status is simple sugars. Sugar alone is pro-inflammatory, meaning when you eat more sugar, your body produces more inflammation. Again, we want to control it. In terms of exercise or a bee sting, broken bones, we want inflammation. We don't want or need inflammation for eating food. So again, that comes down to just making the best health decisions, avoiding sugar to begin with. What's something that kind of comes into play with this is if you have a little excess body weight, which those of us, we know when we do, lose some body fat. Again, just like sugar, fat alone is pro-inflammatory. The more, white adipose or fat cells that we have, the more inflammation our body's just producing naturally. And this ties very much into how things such as diabetes and cancer can end up forming in us from having all this inflammation sitting there, swelling up the cells, breaking them down. We'll save that for another podcast. Just knowing that losing weight and decreasing sugar are two relatively simple things that we can do to lower the inflammation that's in our body so we don't have to feel propelled to take medications nearly as frequently. So just kind of to go ahead and quickly wrap this up, yes, inflammation is a part of our lives. It's a good part of our lives when it is controlled. It helps keep us from damaging ourselves further and also helps really repair ourselves when we are injured or have some issues inside of us. They aren't meant to be taken every day. They are not supplements. They are medications, even if you can just go ahead in the store and pick them up. Taking them long-term can cause very well-known issues. Now adding to the ulcers and organ damage is increased chances of heart attack. All things that personally I know I want to avoid. Again, there are simple things you can do to try to lower your body inflammation to begin with. Turmeric, BCQ, fish oils, decreasing simple sugars, and adding an exercise regimen or some ways to start doing body fat loss also very much come into play. So at this point, as always, if you enjoy what you hear, please help us get out to more people. Leave us an honest 5-star review, always helps. Also, again, as always, if you have any questions, comments, any ideas of things that you want to hear about or ask, either if it's myself, the mad scientist, Jim Getz, Shante, any of us, direct message us. We read it, we listen, we respond. You can get us at Functionised on either Instagram, Facebook, straight through a website at www.functionized.com. Let us know what's on your mind. Come, if you're in the area in Colts Neck, come say hi. Anything. We appreciate hearing from you guys. So, as always, until next time, this is Dr. Mike. I'm out.